When most people think about rotator cuff tears, they think about ball players. In our orthopedic practice here, we see a significant amount of people that have shoulder problems, and not specifically just rotator cuff tears. When we look at the anatomy of the shoulder, it's interesting, and it really has to do with, one, the function of the rotator cuff, and two, the anatomy in which it operates. If we look at the shoulder joint and we think about how much motion we actually have with the shoulder, it's really because of the way it's made. We have a round ball sitting in a flat socket, but there's no doubt that the rotator cuff muscle is really what keeps the ball within 2 millimeters of a flat socket, which, when you think about it, is really amazing, with the fact that you can take your arm and literally put it behind your body. But if you do a lot of, especially overhead activity, a lot of reaching, and in our daily life we do this constantly, there is what's called impingement of the rotator cuff. And when you look at the bony anatomy, and you see as you raise the arm up, there's a pinching of the tissue between these two bones, and that's commonly referred to as impingement. If this occurs over a continuous period of time, and we know that the rotator cuff tendon is sitting directly below this bone and attached to this bone, which is the humeral bone, you can see how often it gets pinched. So the rotator cuff, the function of it is extremely important, but what happens is, because it's so important and because it's used so much, we end up with a significant amount of people that have inflammation.